Good afternoon, Ms. Mohammed.
Good afternoon.
My name is Berilyn Akwe. I am a third year Doctor of Nursing Practice student at the University of Massachusetts Amherst, and I'm in the Family Nurse Practitioner track. I'll be completing your assessment with you this evening if that's okay with you.
It's okay.
Alrighty, thank you very much. Miss Faith. Can you confirm your date of birth with me, please?
May 15, 1974.
May 15, 1974. And that will make you how old?
44 years old.
44 years old. Oh, actually, you just had a birthday.
Mm-hmm.
Oh, happy birthday in arrears.
Thank you.
Okay, you're welcome. So, where are you originally from?
I'm from Nigeria.
Oh,
Western.
so that would be the west of Africa.
Yeah.
My geography is not that bad. All right. So, what brings you here today?
I just came in for follow
Follow up regarding
up. My physical test.
or your physical. When did you have physical last?
2 years ago.
2 years ago.
I skipped a year.
Oh, you skipped a year. So after skipping a year, what makes you think it's the right time to come back?
Just come to check my work.
Or just for your general well-being? That's good. It is important that you're checking up on your well-being. So, did anything in particular prompt you to come in today?
Everything is okay. I just came in to check.
All right, that is good. So, what are you doing to keep yourself healthy?
At times I do some little exercise and I eat a lot of vegetables and fruits. And I drink like 2.5 liters of water per day.
Oh, 2.5 liters of water. On average, how many meals do you eat a day?
Like 2, but most especially I eat veggies.
Okay, I see. Just so you know, I'm just taking down some notes as we speak, so I'll be able to document accurately because I cannot rely completely on my brain.
Oh, okay.
All right, thank you.
Sure.
So you're healthy eating. So what kind of exercises do you do?
Oh, at times we have a staircase in my house. So at times I go downstairs like 4 times a day, or I walk the hallway.
Mm-hmm. So what floor are you on?
8th floor.
Oh, you're on the 8th floor.
Mm-hmm.
Ooh. On how many days a week do you do that? Walking up and down the stairs?
Like twice a week.
Wow, that is actually really good.
Yeah.
That is really good. Okay. And any other things you do to keep yourself healthy?
At times, I just listen to my country music and I'll be dancing to it, and it make me lose some, drop some weight.
Okay, I see. I see. That is good. So you like dancing?
Mm-hmm.
Is that, or do you do a lot of dancing for pleasure or leisure?
I would say both.
Okay. So what else do you do for fun?
I like watching movies because I'm not the party going person.
Oh, okay.
Most of the time, if I don't work out, I'll just be at home. But at times, I go to the mall to do window shopping.
Oh, I see. I see. So, if considering the people you know, most people you know, would you rate your general health as better than them, at the same level, or less than they are doing?
I think I'm better than them.
So you think you're better than most people health-wise? Okay. Any stressors?
No, but I'm just planning to have to get pregnant. So I've been going through a lot of stress about that.
Oh, so you're planning to have a baby. So what are you doing in order to have a baby?
Yeah, I went through some treatment through my gynecologist, but you know,
So, do you have any other children?
No, I just have only one.
Oh, so you have one. You're trying to have more. Are you? Do you have a partner that you're trying with?
Yeah, my husband.
Oh, you're married.
Yeah.
So you have. And do you live together with your husband?
Yeah.
Okay. And how old is your first child?
My son is 25 years old.
Oh, you have a boy. Ooh, a 25-year-old boy.
Yeah, I gave birth when I was in high school.
Oh, okay. You really don't look like you have a 25-year-old. So are you still following, excuse me, are you still following up with the gynecologist?
Yeah.
Okay. So when was your last menstrual period?
Last month it was on the 25.
Okay. So on the 25th of May was your last menstrual period.
Yeah.
And do you have regular periods?
No, irregular.
Or they're irregular? And how often do you have them?
I think every Saturday.
Okay. And how is your flow?
Not really not really heavy, like medium.
So, how heavy is, do you use pads or tampons?
I use the smaller, tiny one.
Or the small pads?
Yeah.
Okay. And for how many days do you go?
Like 3 days. But
3
it's
days.
not
Light. So you have a light flow for 3 days.
yeah.
Okay, I see. And any other stressors apart from trying to have a baby?
Mm.
And life at home is good with your husband?
Yeah.
And your son is being good? He's 25.
I know.
Does he still live home with you?
No, he's back home, but he always come in for visits and he'll go back.
Oh, he's back in Nigeria.
Mhm.
Oh, I see.
Only come in for visit.
Okay. So he is an independent young man?
Mm-hmm.
Okay. And is he living alone back in Nigeria?
No, he's living with my baby sister.
Okay. Okay. So you have family back in Nigeria.
I have
So you're not worried about him there?
No.
Okay. I see. I see. Looking back from when you were growing up, have you had any serious illnesses?
Yeah, and then when I was small, I have a lot of what is it called? Worms.
Okay. Worms?
Yeah,
What kind of worms?
I can't recall it. I can't remember because I was small then. But my mom told me that if I want to poo, it's only one.
Worms.
So it really,
And did she usually seek treatment?
yeah, they don't want to take me to the hospital.
Okay, okay. And any allergies, food allergies, medication allergies, even environmental like dust or mold or no? Wow, that's good. And what of, apart from the worms when you were growing up, did you have like measles?
No.
No measles? What of mumps? Mumps, the thing that makes people's jaw swell and could be painful? No? What of chicken pox?
No.
No? So you didn't have any of those childhood illnesses?
But I know I normally have malaria.
Malaria? Oh.
Mm.
Malaria is common in Nigeria?
They are very common because when you have especially when the mosquito bites you.
Mm-hmm. Oh, okay. So malaria and
And there was a time I don't know if you know what they call typhoid fever. I do have typhoid fever too. Chronic one.
Okay. Typhoid fever, malaria, worms. Okay. Any other sicknesses that you can think of?
No.
And any hospitalizations, major hospitalizations?
Yeah, that's when I have the chronic typhoid fever.
Also, when you have the typhoid fever, you get admitted. When was the last time you had typhoid fever?
I can't remember because I was still in high school when I got this.
Oh, okay. So you were still in high school.
Mhm.
So that was a while back. And any Immunizations? Have you taken any vaccinations?
Back home, but I've never taken when I came here.
So which ones did you take when you were back home?
But I know I took before I came in here.
Oh, so you took
Mm-hmm.
some vaccines before you came in here?
Yeah, because we have to take them before.
Oh, I see. Okay, so if I named some of the vaccines, would you remember like
Okay.
varicella?
Yeah.
So you had the varicella vaccine. The
The TD, right?
no, the TD is the tetanus.
Of course, we had.
Okay, so
that one is common.
So you have the tetanus
Mhm.
and the varicella.
Yeah.
Okay.
I have one here. And one here.
What of hepatitis B?
Yeah, I had it when I came in.
How many did you take for the hepatitis B?
I think I'm.
2 or 3?
Oh. No.
Okay, hepatitis B you did take. In any case, we actually can order some labs to see what you're immune to. It's called a titer. We can see if you are immune to those major diseases that you need to be vaccinated against. So is that something you'd be willing to do?
I don't mind.
Okay, so we can order for those. Have you ever had any surgeries?
Yeah, sounds right.
Did you have your son naturally or was it a C-section?
I have it naturally, but I think I have one surgery in 2014 when I had a miscarriage.
Oh, you had a miscarriage in 2014. So what kind of surgery did you have?
They just.
Oh, like a DNC?
Yeah.
Okay, so you had a DNC in 2014. I'm sorry about that. So, apart from the DNC, any other thing you can think of? Okay. So, have you ever been involved in a car accident?
Yeah.
How long ago was that?
That was 2001.
2001. And did you go to the hospital after the car
Yeah.
accident?
Because the car was right off, so we have to. The car somersaulted from the main road inside the bush. So when the car landed, everybody came out through the windscreen. So after the last step, the car just got exploded. So we are crawling around so to the road before they now saw us. So they just took us to the hospital. They took us to Lagos.
That must have been very scary.
Yeah, since then, that's why I always say I can't drive in this country because
So you don't drive.
I don't drive. So before we came out from the car, we've already gone in the car. So it's the one that gave me all
Oh,
this
I
mass.
see that. I'm sorry about that. So, when you went to the hospital, were there any abnormalities like broken bones, fractures?
No, we just
or-
have bone all over our bodies. But they treat everything. My lips got burnt on the side of my nose and my hair and my bum bum. There's a fire. There was a fire burning us in the back seat before the car eventually landed. Before everybody came out.
That must have been a stressful event. But your skin healed nicely.
I know. This one, all
Yeah.
this place, I didn't even know. And it's coming out like oil. Because we're four in the car. My half sister and my
I hope everybody survived.
everybody survived.
Any major disabilities from the accident?
Yeah, my half sister has a big something dark, black something. I think it's the fire that burnt her. So it was thick and it was so big at the back here.
I'm really, really sorry about that. That is understandable that you're scared of driving.
Yeah.
Yeah. So, but you said you had your son naturally, it wasn't a C-section.
No.
Did you use any anesthesia?
You don't even know what is that back home.
So,
Because I'm so young then, you know.
oh yeah, so you went all natural. Oh, you were a strong little girl, huh? That is good. That is impressive. So, do you take any medications routinely?
I was on a blood pressure medication, but I don't normally take it frequently. I take it once in a while.
How is that?
It's just that I don't like taking medication.
You just don't like taking medications? So, do you know what medication you're taking?
But I don't remember.
Okay. And how often do you see the prescriber?
Like every five weeks, but I miss my my last appointment, so I just schedule for.
So, how is your blood pressure usually at?
I do check it for myself at home because I have the machine at home. The last one I took was 2 days ago. It was 160.
It was 162. And what was the bottom number?
89.
89. Okay. So, apart from not just wanting to take medication, is there any other thing that you think could help with your blood pressure or could help you take your blood pressure medication?
I was thinking if there's any way for me to take natural remedy than to take most of these medications they have side effects. So that is why I'm afraid to take them because I don't want to be taking this to suppress my blood pressure and at the same time the side effect will be will affect my liver or kidney.
You are absolutely right. Medications do have side effects, but the good thing is that if a medication is before a prescriber, before a physician or a nurse practitioner prescribes any medication, they've weighed the benefits of the medication and the risk of taking that medication for you as an individual, and they have all different factors put into the decision-making process. So when they're prescribing you that medications, you know that the benefits outweigh the risk, because it will be irresponsible for any practitioner to prescribe a medication for you that has more risk than benefits. So I think you should talk more with the prescriber, or if it's coming here, I don't know, did you plan on switching to see us here for your prescription?
Yeah.
And then we can talk more about that, or if you want to continue with your prescriber, the specialist following you up for the blood pressure, you can explore those options with them.
Okay, I'm so much.
Alrighty. So, do you take any over-the-counter medication?
No.
No.
I take multivitamins.
Okay, so you do take multivitamins. Are they prescribed or you just buy them?
They are prescribed.
Okay. So any other thing?
No.
And do you take the multivitamins every day?
Only like
Once. Okay. But on the plus side, you're eating fruits and vegetables, so that will help with the multivitamin part of it. But I think it's still good to take your medications as they're prescribed.
Okay.
Alrighty. So you talked about your son being in Nigeria with your sister. So, are your parents also in Nigeria?
No, I lost my parents years ago.
Oh, I'm sorry to hear that. And how did they pass?
My mom just had a malaria for like 3 days.
Hmm.
So
And what of your dad?
my dad has cancer.
Oh, what kind of cancer did he
Lung cancer.
have? Lung cancer. How long ago did they pass?
My dad passed in 2009, and my mom passed 1989.
Oh, you were pretty young. Okay. So, do you have siblings? I heard your sister and
Yeah,
your
I
half
have,
sister.
I have 4 siblings.
You have 4 siblings, and how are they doing health wise?
They're all doing good.
And how is your relationship with your siblings?
I do call them all the time.
Oh, so you guys maintain open communication?
Mm-hmm.
Okay. And so you're here with just your husband?
Yeah.
All right. And how is that?
It's good. It's okay.
It's okay. Just okay.
Everything is fine.
Okay. That's good to know. So, do you have like friends?
I have friends, a lot of friends, but I don't have a close friend that will come to my house or I go to their house. But I have my friends at work, so.
Oh, at work. So, you only have friends at work, but not friends that will come to. Is that how you prefer it, or you like to exchange visits with your friends?
It's because the way I met my husband. He doesn't have friends, and I don't want to start.
Oh, so you don't want to intrude in his. Oh, that is very considerate of you. So, and what kind of work do you do?
I'm a nursing assistant.
You're a nursing assistant. Oh, that's great. So you're planning to be a nurse someday?
I wish.
You wish?
Yeah.
Only wishing?
I wish.
So what is stopping you from being a nurse?
We are not equal. I like to be a nurse, but I don't really have what it takes to be a nurse. If you don't have this thing up there.
Oh, if you've been a nursing assistant, I think you can do it. You just have to believe in yourself.
I know,
But don't push yourself too hard.
it takes a lot of dedication
Mm-hmm.
and concentration to be a nurse.
Yeah, you're right about that. Yeah, so you know yourself, so you know your abilities. Don't push yourself too hard. Mhm. So, and so, any other supports besides your friends at work? And do you have any other supports? Are you affiliated to any social group or religious group?
I'm a Muslim.
You're a Muslim and a practicing Muslim?
Not really.
Not really. Okay. So do you go to the mosque?
I go to the mosque once in a while. On Sundays we have a gathering, like the way you guys go to church. So we have a gathering on Sundays that we pray. So anytime I don't work on Sunday, I go with my hobby. But I go once in a while.
Okay. And are you sexually active?
But I'm active, but I don't really like sex.
Why? Is it painful?
It's not painful. I don't know why.
Is growing up, was it a subject that you talked about?
No, it's because I stayed like some years before I met my husband. And by the time I met him, I don't really enjoy sex anymore.
Okay. That's okay. And financially, how are we doing?
I'm doing good.
Okay. All right. Is your husband working too?
Yeah, he's a cab driver.
Oh, okay. So, do you work full time or part time?
I work full time.
Alright. Is there anything you want to add before? I'm going to ask you actually a series of questions. They are mostly yes or no questions. But if there's any other thing you feel like letting me know or it's important, please don't hesitate to stop me and ask or let me know. So, have you had any weight changes lately?
Any what?
Weight. Have there been any changes in your weight?
Yeah, I think I had more weight.
You gained some weight?
Mhm.
About how many pounds? 2 pounds. Okay. And do you feel fatigued or tired a lot?
Yeah.
And
Most of the time it's because I have two jobs,
oh,
and normally I don't really have enough sleep.
2 full-time jobs? 2 full-time jobs. So when do you sleep? When do you rest?
Whenever I am very tired most of the time.
No. You need to take it easy. You said you're trying to have a baby, so
I know.
you need to take it easy on the stress on the body too. Okay. Any fevers? Any fevers?
No.
Chills? Like you're shivering inside?
Once in a while, maybe when it's cold and I'm drinking cold something.
You like drinking cold stuff? And night sweats?
Mm-hmm.
Do you sweat heavily at night?
No, not heavily.
Okay.
At times when there is heat, the AC will not be able to.
Mm-hmm. Yeah. So you sweat mostly in the what time of the year?
During the summer.
During the summer?
Mhm.
Okay. So any changes in your skin?
Yes.
Itching? Any rash? Lumps? Any moles?
Mm-mm.
No. Okay. What about your head? When you were in the accident, did you hit your head?
No.
Okay. And do you often have headaches? Any nausea or vomiting?
Yeah, I don't know him all the time. Maybe anytime I wake maybe in the month.
Okay, when you're cleaning, is it when you put the brush in your mouth or just when the toothpaste gets in your mouth?
When the toothpaste get into my mouth.
Also, you just don't like the taste
Yeah,
of
maybe I
toothpaste.
don't like. But all the toothpaste, no matter, I don't know. Because then, before I realize it, I always think I'm pregnant. But
Any changes in your vision?
no,
What of your ears? Can you hear me all right?
of course, I can hear you clearly.
Any pain in your ears? Any discharge? Do you feel like you're off balance at times if you're standing? No. And what about your nose? Do you feel stuffed? Any pain around your sinuses or tenderness around these areas? Any pain? Any sneezing?
No.
Any wheezing?
Mm-mm.
Okay. Do you have? You just said you don't have any cough, right? Okay. So do you have any allergies?
No.
Nosebleeds?
I don't even know what is allergy, not until I come to this country.
So there are no allergies in Nigeria.
Maybe, but
You just never heard of them. Okay. So and you don't feel like if you're itchy in the nose, sneezing, having a runny nose,
no,
or feeling really stuffed up in your nose.
that is when I have cold.
Just when you have a cold. Okay. And we're talking about getting nausea when you're brushing your mouth. So do you have any bleeding?
At times, because I use the hard brush back home, I don't use the soft brushing.
Oh, so you use a hard brush. That any sore throat?
No.
Do you feel like your throat is swollen?
No.
Okay. Do you have any shortness of breath
That is when I know.
when you're running? Okay. And you don't have any cough? Any chest pain?
Yeah.
Okay. Like right here.
Mm-hmm.
And when do you usually have that chest pain?
It just come and go.
How often?
I do maybe every month.
Every month? Is there a particular time of the month it comes on?
I didn't take notice.
You didn't take notice? Okay. Does it spread anywhere else?
Yeah, at times you hold you hold my breast at times too.
Is there anything in particular that causes the pain to come on?
I don't think so.
Okay.
But
And
now,
do you do anything for it to go away?
no, I used to feel maybe there's something. What was it called? So I used to do it by myself to feel maybe there's some
Or
lumps.
lumps in,
Lumps.
but have you felt any lumps in your breast?
Mm.
Any skin changes in your breast?
No.
Okay. So both breasts, when the chest pain comes on, is it both breasts that also have the pain or just one breast?
At times both, but especially I feel pain on this.
On the right side.
On the right side.
Okay. Have you had a mammogram?
Yeah, I like 3 times that I went there, they didn't do it for me because when I go, they always tell me I should go and do pregnancy test.
Mm-hmm.
I think the way my breast look like, it look like if I'm pregnant.
Mm-hmm.
So when they started saying that, so I just
Okay. So you still haven't done. What of the chest X-ray? Have you done one?
just
When was the last time you did it?
2016 or 15. When I did it, that when I did my TB test. So now
Okay. So how was the chest X-ray?
it's okay.
So it was normal. What of an EKG? Have you done one?
Yeah, I did one 2 years ago.
And how was it?
It's okay.
Okay.
It's,
So do you get palpitations like your heart is pounding? And shortness of breath with exercise.
Yeah, when I'm running or when I'm doing exercise.
When you're running. Oh, you said you did the tuberculosis test and the chest X-ray. Why did you have to do both of them?
You know, when they check it, when I did this, it spread.
Oh, okay.
So they said this one, even though it spread, it doesn't mean maybe I have it. But when they check the X-ray will tell them if I have the tuberculosis.
Okay. So did you ever get the vaccine for tuberculosis back in Nigeria?
Yeah,
Oh, okay. So
and I have it here too.
Oh, okay. I see. So, any asthma or pneumonia? What of emphysema? Okay. So, you don't even know what it is, so you don't have it. So, have you ever had tuberculosis infection?
Yeah.
The actual disease, have you ever had it? Tuberculosis.
Yeah, tuberculosis. You can get infected through blood or through
It's airborne. Yeah. So, have you ever been sick of it? No. Okay. That was a no. How is your appetite?
I have that is okay.
And you eat a lot? Any nausea or vomiting?
Nausea.
Nausea. And is it the same any other time apart from when you're brushing?
Yeah, at times I don't know. I want to try to check this one because I was thinking maybe when my period is coming up, that is when I know. So I want to check.
Any diarrhea or constipation?
I had one about I think last month.
And what of distension? Do you have stomach distension, yeah, abdominal distension? You feel like your belly is all swollen and full?
Mm-hmm.
Okay. And how often do you move your bowels?
I don't know.
Do you go every day?
Before I go every day, but now I take like 4 days, 4 days or 3 days.
3 to 4 days before you go. Since when did you start going every 3 to 4 days?
Almost a year now, because before I go every day, every day.
Even with your diet and exercise and water, you still go 3 to 4 days. Are you taking anything for that? No? Okay. And when you go, do you see any blood in your stool? Okay. And how's your urine? Do you have any pain urinating? Do you get up in the middle of the night to go pee?
Yeah, once in a while I do that. But when I wake up, I won't be able to sleep again.
Oh. So, on average, how many hours of sleep do you get?
Maybe 6 hours or 5.5 hours.
Okay, 5.5 to
Like
6.
yesterday, I got home around 12, I got home 12 sharp, and I woke up 5:34 this morning.
Okay. So you get 5 to 6 hours. Is it interrupted or you just go to sleep for 5.5 to 6 hours before you wake up?
It depends on the time I came back from work and
Sorry about that. Okay.
so and there are times mean that I think my body have already
It's already used to.
used to that time, even though I always put on alarm,
Mm-hmm.
but my body doesn't follow the alarm. I wake up before the alarm.
So any urinary tract infections?
No.
Any pain with urination?
No.
Any excessive vaginal discharges?
No.
Okay. Alrighty. So when you go to pee, do you just go or your stream, the urine stream, is it slow or okay?
It's okay.
Alrighty. Okay, so this actually concludes this phase of the assessment. We're going to continue with the physical exam. If you could please hop on the table, that would be great.
Okay.
Alrighty. So you can sit right here. And I am going to clean my hands. Before we start, I'm going to check your blood pressure.
Okay.
Okay. So you are, I see from the intake here that you are 160 pounds and you're about 5'8" in height. So I'm just going to check your blood pressure and I will do that. Let me see both hands just to make sure that they are okay. We don't have any fistulas or anything that will prevent us from using. Do you prefer either hand, arms? Anyone is good? Okay. So I want to first of all check your pores right here. Ooh, that's a beautiful pores. And then I want to check this one as well. Excellent. Yeah. So this one is a +2 and the other one is a +1 on the scale of 4, which is good. So can you relax your arm for me? Actually, I'm going to take this up so I've got, it's not gonna let me. I'll leave it there. So first, I just want to see where your systolic blood pressure could be. Where was our pause? $160 or $90, that is high. Did you take your blood pressure medication this morning?
No, I'll check them by them.
Okay. So I am going to put on my gloves because we're going to do a head to toe exam. I want to start by looking at your hair, if you don't mind, please. Okay, can I take off the scarf?
Yes.
Alrighty. Wow, you have thick black hair. I'm just looking at your scarf. That is beautiful. Very thick and dark hair. Beautiful.
Thank you.
That is good. Your scarf looks clean and there's no scaling, which is good. So I'm going to massage or palpate your scarf and your skull. Tell me if you feel any tenderness. That is just a check to make sure that you don't have any break in your skull bones, which seems to be intact, and your head is normal size, which is great. So take off this glove so I can check your temporal pulse. That's beautiful. That's a +2 on 4 on the left side, and on the right side it's also a +2. That's a bounding pulse. Can you open and close your mouth for me, please? Close, open, close. Nice. I'm just checking this joint right here. It's a temporomandibular joint. It's smooth, which means there is no break. And your face is symmetrical. You can open your eyes. Your face is symmetrical. There is all your facial structures seem to be aligned properly, which is great. So I'm going to take a look at your. Can you just do that for me, please? Close your eyes. Okay, that's fine. That's fine. You can open. I just wanted to check to make sure that your eyelids are not drooping, which is great. So, and I'm going to look at your eyes right now. I'll start with looking. Okay. I'm going to go. That's good. That's good. Let me see your conjunctiva. Oh, it's nice and pink. Your sclera is white, and your cornea is clear. So can you just keep your head straight, focus on me, follow this pen light only with your eyes, please. That is beautiful. That's to check to see the muscles of you that hold your eyeballs together, that they are functioning right, which of course they are. And if you could do me a favor, and can you cup your hands and close one eye? And if you could, can you read these letters from here? C-I-D-7. Great. And then can you read? Okay, now you can let that eye go, relax it, and then close the other eye. Alrighty. Can you read these letters from backwards? 7-D-I-C. Perfect. Thank you very much. You can let that go. Can you stare at that hanger for me for a moment? Just sit down and just look at the hanger. Okay, can you look at the pen? Alrighty. I'm going to flash this light at the tip of your nose. Can you just open your eyes for me? Beautiful. Alrighty. So I'm going to go ahead and check your ears. So first I'll check the skin, which is clear. There is no obvious discharge. And this side is also clear, and this color is the same as your face, no obvious discharge. Let me know if there is any pain as I palpate your ear. Any pain? What about this side? Any pain? All right. So I'm going to take a look inside your ear. Okay. Okay. That is nice. There is no perforation and there is no bleeding or discharge in your ears. Just some mild wax, but it looks fine. Let's see this side. The same thing on this side, mild wax, no perforation and no bleeding. Everything is fine, there's no discharge. So I'm going to take a look at your nose, which seems to be, let me change that. Can you smell all right? Okay. Your nose seems open, and your nasal septum, that's the bridge, is in place. It's not, there is no perforation, and it's not shifted to one side or the other. So it's right in the center, which is good. So I'm going to palpate your sinuses. Let me know if you feel any tenderness. Any tenderness? Any tenderness? What up here? Any tenderness? Okay. Any tenderness? Any tenderness? Any tenderness here? Any tenderness over here? All right, that's great. So, so I'll move on to your mouth. So can you just say ah? I'm going to use this light to see. Say ah. Okay. Have you ever had any problems with your tonsils? Nice pink tongue. Your uvula is centrally located. Your hard and soft palate are intact, which is great. Can you take your tongue to the roof of your mouth? That too is beautiful. Let me see your teeth. Oh, just open. Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31. Okay. And your teeth look well taken care of.
Thank you.
You're welcome. Do you see a dentist regularly? Do you use any glasses in reading? Okay. And do you see an ophthalmologist regularly? No? Okay. So I just want to palpate your lymph nodes around your neck area. So let me know if you feel any pain or tenderness as I go along. So that's preauricular, postauricular, submandibular, submental. Can you just lift your arms like this? Just your shoulders. Okay, great. So none of them is felt, which means they are not swollen or tender, or they are not swollen. Did you feel any tenderness? Okay, can you just take up your head and look at your neck? Okay, your trachea seems to be in place. I'm going to go to the back to check your trachea and your thyroid.
Okay.
And I'll give you this.
Okay.
Okay.
Are you doing
You can if you need to. Alright. This is going to feel a little bit uncomfortable.
Okay.
Okay, your trachea, it's okay. Can you swallow, please? Excellent. Swallow again. Beautiful. Your thyroid is in good condition. While I'm still back here, I'm just going to go ahead and listen to your lungs from the back.
Okay.
Okay. First of all, your back is clear, your spine is straight, no scoliosis, and no rashes on your back, which is good. So, let me know as I palpate your back if you feel any tenderness. Okay. So I'm going to put one finger on your back and strike it with another finger. Just let me know if it feels uncomfortable. Okay. Beautiful resonance. So I'm going to listen right now. Deep breath in, out. Good. In, out. In, out. In, out. In, out. In, out. In, beautiful. So your lung sounds are clear in the front. I am going to come in the back, sorry. So I'm going to come here. Actually, hold on one sec. Let me check something else. You hear me stomp on your back. Let me know if you feel any tenderness. Any tenderness? Any tenderness? Okay. So, okay. So I'm going to take a look over here. So let's have you lie down. So, that. Okay. Alrighty. So I'm going to check your carotid. Okay, artery. Ooh, that's a +2, solid. And on this side, same here, +2. And let me listen for Bruce. Okay. So can you turn your neck to the other side, please? That's my right ear. Just looking for pulsation. I see your jugular vein pulsation right there. Alrighty. There is pulsation right there. Now I'm going to also look at your precordium. Okay. And can you turn to this side, please? Right there. And okay. Okay. So let me just take a look at your chest. Let me know. I'm going to palpate the same thing I did in the back. I'm going to do right here. Let me know any tenderness. Any tenderness? Okay. Beautiful. Beautiful. Nice. 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 The dress is not gonna let me. Okay. So I'm going to listen as well. In, out. In, In, out, in, out, in, out, out. Okay, let me in, out. Nice. Alrighty. Let me go to the other side. Okay. Do you usually do a self-breast exam?
No.
Once in a while. Do you do it sitting, standing, or in front of a mirror?
Sitting.
Okay. So when you do a self-breast exam, you want to do one sitting, one standing, and one while lying down. And when you palpate, you go all the way to your armpit, and you choose if you want to go in circular motions or you want to go straight, but make sure you palpate all breast surfaces and you express the nipple as well to see if there is any discharge. If there is ever any discharge, a change in the skin or any swollen or any lumps, you need to follow up with your provider immediately. All right. So I'm going to check your apical pores. Right here. Alrighty. So that is a +2 on 4, and it is at 82 beats per minute, and it's a regular. So I will check your heart sounds right now. This is the locked up, 58. Sure, this is the pulmonary locked up. Wow, that is so clear. That is Earth's point. Locked up. Wow. And we're going to do the tricuspid, which is right here. Okay. And then we are going to do the mitral, which is right here. Nice. Okay, so I'm going to check your abdomen. And if we could do that. So nice, flat, rounded somehow. Your umbilicus is rounded, and using my pen mic again, I'm going to look for pulsations. Pulsations. Okay. Before I do anything with your abdomen, I want to listen to your bowel sounds. Okay. And oh, while I'm at that, I might as well listen to your aorta. No bridge, which is good. So some dullness. When last did you go? When last did you go
Who?
to the bathroom? When did you move your bowel?
Do that today.
So I'm going to palpate. Let me know if you feel any tenderness. Any tenderness? Okay. Any tenderness? 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 Let me try to palpate your spleen, which is non-palpable. And let's see your liver. No. Okay. So I can help you sit up. Before you do, let me check your inguinal pulse. That's your femoral artery right there. That's a +1. And that's a +1. So I'm going to help you sit up. Okay. The skin, your skin on your legs and feet looks good. Your nails, okay. No clubbing. All right, and they are warm. Any tenderness? Okay. And your capillary refill, less than 2 seconds, which is good. And I'm going to strike you right here because I'm testing for your patellar reflexes. Okay, just relax. +1. That's another +1. Okay. Let me see your arms. Alrighty. You bite your nails? They're really, really short. Okay. Your hands are warm, your arms are warm, your muscles, okay. Alrighty. So, can you relax this arm for me? Let it go. Just let it go. Leave it. Have it. Let it go. I have to improvise. I don't have a reflex hammer, so relax. Okay. All right. Can you spread out your arms up to the back? Yeah. Okay. Don't let me. Can you shrug your shoulders? Don't let me push them down. Okay, good. And don't let me push you. Alrighty. Don't let me push. Good. Alrighty. Can you calm down, please? Alright. Can you bend to your toes and back? Let me tap that. And back up. Great. And good. So, can you do the heel to toe walk towards? And then walk normally back to the chair. And normally back to the table. Alrighty. Just come over here. Close your eyes. Put your feet together. Close your eyes and hands to the side. I'll tell you when to open. All right, you can open. That's telling me that your cerebellar functions are all right. And just before we go, let me check the other pulses on your legs. You can sit. You can go ahead and sit. Okay, I'm going to check your popliteal. +1 on a scale of 4. Check your posterior tibia. That's a +1, and over here, that is your, oh, that's a beautiful one. That's your dorsalis pedis. That is good. That would be here. That is +2 actually, on a scale of 4. On the right dorsalis pedis, right posterior tibial. That is a +1. And let's do the right. That is also a +1. So can you just close your eyes for me for a second and let me know if you feel sharp or dull. Do you feel sharp or dull? Okay. Close your eyes. Ah! Just close your eyes. What do you feel? Just say, don't open your eyes, just close your eyes and tell me if you feel sharp or dull.
I feel sharp.
What do you feel? What do you feel? What do you feel? All right, you can open your eyes. So thank you very much.
You're welcome.
And I hope you follow up.
Yeah, I will. Thank you.